So every day I've been here, nurses have taken on double patient loads. The patients just need a lot. They're very sick, and there's a lot of them. ICU is exhausting as it is. COVID pandemic, it's just like tenfold.
That's why Britta Jensen is here in Toronto from her native Vancouver, deployed by the Canadian Red Cross to help.
So I've been an ICU nurse for 8 years now. I've worked 3 shifts here. I feel like I've been working for a month.
When the pandemic started, Jensen was home on maternity leave but felt compelled to help her nursing colleagues, so she reached out to the Red Cross.
I was working in long-term care homes, helping provide public health support to them. I worked in federal prisons for a little bit, and then worked at the border doing testing for a few weeks. And then the call came that they needed nurses that could do ICU support.
A major concern throughout the third wave of the pandemic has been the pressure on intensive care units and a shortage of skilled nurses to help care for the rising critical caseload.
I applied essentially thinking I was doing vaccinations because I work for Doctors Without Borders and I did a lot of vaccination campaigns.
Instead, longtime trauma nurse Nicole Dessy was also deployed here to Humber River Hospital.
So for me, it's more just like how busy it is, like how sick the patients are, how young the patients are, the amount of resuscitations that I've seen here.
21 years working in ICUs, and this nurse was on the verge of retirement, but those plans were put on hold.
I need to help my colleagues. I need to help the public.
She worked the front lines during the SARS outbreak and H1N1 pandemic, but COVID-19 is unlike anything she has seen before.
It's very sad being in a situation like that. I will go into the end to help. I go into the end.
A team of nurses providing relief in a time of need. Caryn Lieberman, Global News, Toronto.